Hi, my name is Samantha Fitzgibbon, and I'll be talking to you guys today about Ehlers-Danlos syndrome, or EDS. EDS is a connective tissue disorder that is caused by genetic mutations in the genes that regulate and produce collagen within our body. This then causes fragile connective tissues and connective tissue deformities throughout the body. There are 13 different subtypes of EDS, and depending on the subtype is dependent upon what symptoms that the patient will show. Some of the more common symptoms of EDS is joint hypermobility beyond just being normally hyperflexible. So they can pull their thumbs to their arms, they can hyperextend their elbows, they'll hyperextend their knees as well. And I don't have EDS, but I just have really hypermobile joints sometimes. And the other common symptom for people with EDS is skin hyperextensibility, so very fragile, thin, stretchy skin, so they can pull their skin away from their hands and just away from their skeleton as well. Sometimes it looks like the skin is just hanging on their bodies. And because of the fragile skin tissue and the joint hypermobility that's common with most subtypes of EDS, there's a lot of chronic pain that these patients suffer, and so pain management is the key because there is no cure for EDS. It's just about managing the symptoms. So that comes in forms of pain medication sometimes, or injections, sometimes blood pressure medication, because there is an EDS type that is vascular type, and it does affect the vascular tissues and also the lining of the organs and the connective tissues that tack our organs in place within our body. Sometimes a patient with EDS will be referred to a physical therapy clinic like this one, and they'll come in for things like dry needling, range of motion, manual therapy, which is similar to deep tissue massage, and even strength exercises and stability exercises in order to alleviate that pain and to increase their quality of life. And so EDS does not shorten the quality of life of the majority of people who have it. It just simply diminishes the quality of life that people suffer from with chronic pain, sometimes headaches, stomach aches, all sorts of problems, but they won't die necessarily prematurely. However, with vascular type EDS, they do have a premature death rate of no more than 50 years old, and that's because there's stroke at a young age, vascular rupture, and organ rupture as well for people who have vascular type EDS. So that is EDS in a nutshell. Should you have any other questions, please comment below, and I hope you enjoyed. Thank you very much.